Good morning. It's a pleasure to be here in Spain, and I'm very appreciative of my colleagues from EUFIC to invite me to be part of the presentation this morning. As Josephine said, I'm going to set this up by basically talking about media headlines from a consumer's perspective, and does that really equal credibility and trust? You all probably have a definite opinion, and you could say yes or no, and I can move on, but I'll give you a little bit of insight before we do that. As noted, the International Food Information Council is the US-based. Our primary goal, of course, is to work with a variety from government, health professionals, journalists, to really communicate science-based information. And through our foundation, it's to communicate, to bring about public understanding. And I believe, as Josephine said this morning, that's the real issue here when we talk about credibility and communicating, is really to bring about consumer understanding. And we know that consumers, wherever they're based in the world, have a multitude of opportunities to hear about food and nutrition. And I think the real question that I will help at least provide some perspective on is that consumers hear, but do they understand, and does it really motivate them to change? Over the years, as with EUFIC, we do a lot of work in consumer insights, and it's only important that we do because with our mission is to communicate to the ultimate consumers, we need to understand where consumers are. And I'll give you a few insights from our annual food and health survey, which really looks at a variety of perspectives. I'll just give you a quick snapshot from really consumer information this morning. But it's important that we understand where consumers are so that we can look at those gaps, identify them, and be able to communicate in a way that may bring about understanding. The reality is that food is in the news, and it can be from a variety of sources, and this just shows you icons and pictures of obviously big issues that have occurred in the US and globally, which many of you probably have seen, from the USDA My Plate, which is, helps frame the US dietary guidelines, to of course that where weight has become entertainment. The biggest loser, is now entertainment. My concern, it does show that folks really have to work very hard on diet and exercise. However, I'm concerned that people are sitting on the couch watching that as we talk about. But we know Food Network, obviously folks are really focused on cooking, but many times, at least in the US, it's somewhat of a habit that people are putting in very elaborate kitchens only for admiration and not preparation. So in that reality is that, and then we know that a lot of headlines really focus on some of the issues around processed foods as well. When we really look at what is framing the issues, this is kind of our issues driver, and it really is a global perspective. I think when we look at this reality, though, we can say that the issues really stem around folks wanting to know what's in our food. And even though I feel now very blessed that I grew up on a dairy farm in the US, obviously we say now within the US probably less than 2% of our population really have a farm-to-table experience, so to speak, that are connected with agriculture. And so we do know that not having that basics and knowledge does bring about a lot of concern about what's in my food. And of course, many times headlines can contribute to that, or they can also put a perspective to that as well. Along with that, obviously we have major health issues, and obesity, of course, drives a lot of these issues as well. And with the emotion that is coupled with science, it really drives a lot of our issues. So just to give you a real, we pulled many headlines globally as well as US just to set the stage. And if you take a quick look, probably not surprisingly, most of these give somewhat of a negative bent on what not to do, and I think a lot of times consumers will say, well, then I'll just not pay attention to anything and do whatever I want to. We also know that with traditional media globally, it's not the traditional media may hit the headlines, but that's really not always what people are really looking at. It's really, tradition will help drive the social media. And in today's world, no matter in what part of the country, world you're in, obviously there's different forms of Twitter and Facebook, but social media means that anybody can be an expert. But it also talks about, this is just a perfect example. I'm not sure as how many of you heard in March of 12, suddenly there was this whole media campaign about eliminating, well, it was finally textured beef, but of course the term pink slime came about. And even though there had been some comments questioned by those former employees that worked for food safety, a mom started the crusade, and probably within less than 2 weeks, finally textured beef was used as part of the ground beef product for the school lunch. And despite the fact that there was no safety issues, no one ever talked about the safety issues or whether the nutritional profile, is because the term pink slime went along, is that USDA immediately took it out of the school lunch. Within a month, the company, 3 or 4 of the plants closed down, and hundreds of people lost their job, and it was from social media campaign. So let's talk about really what it is we know. And from this past January in the Journal of the Academy of Nutrition and Dietetics, we published a 5-year retrospective of our food and health surveys. And I think one of the takeaways is that with instant access to information, it might seem that Americans have knowledge literally at their fingertips, except I think it shows that evidence suggests they're not really acting on their knowledge when it comes to making decisions about food and health. Prior to the initiation of the Food and Health Survey is that for 10 years, the EUFIC Foundation actually did trends in news reporting. And even though this is older than last year, I think what you'll find is, just to give you a quick glimpse on this, this news reporting and the 10-year retrospective was printed in a peer review in Nutrition Today a couple of years ago, really shows basically a lot hasn't changed, but really sets a framework for discussion. If you say here is what is interesting, apparent is that the practical knowledge and perceptions of a healthful diet are directly influenced, of course, by what they see, hear, and read. This just gives you the methodology. Obviously, during those, the last one over the years was looking at 1,340 studies. As you can see here, 40 news media outlet. But I think this is what's interesting, because you will find that despite from that survey and what is current, is that where consumers say their top information of sources are. Not surprisingly, media. Media becomes the first top sources, followed by medical professionals, and then a lot of times it's family and friends. What's interesting is that really hasn't, that was in 2005, and then in our annual Food and Health Survey, and this was from 2010, you'll find that the variety of media sources, if you looked at all of them together, 68% basically say, people say that that's where they get their information. Ironically, if you look at details underneath that, you'll see one that says, it says from the food label, and then family and friends. Even though I don't have that particular slide, I will tell you is that what's interesting is it has been reported in our surveys that people say, yes, they rely on their families and friends, but when we ask about trusted sources, they don't rise to the top. So it's like, I'll listen to my family and friends, I may just not trust them. But here's what's interesting is that when we saw, this is from the Food for Thought, which is really synonymous with what we've found, is that even though consumers say the media is their #1 source, when it comes down to what's believable in this point, you will see from this particular survey, they really say that it is the medical profession. Obviously, medical profession and health professionals are more believable than when it really comes to over media. And then, who's the most influential? And this was a question that asked, so who's the most influential that would motivate you to make a change? And in this particular aspect, you'll see again, it's health professionals say it's most likely to Registered dietitians were under there. But obviously, media was much lower, saying that it would really influence them. So what do we know? I think when we look from a media outlets, we see that media outlets are the primary source of consumer information on nutrition, food safety, and health. But accuracy and helpfulness may be lacking because of consistent lack of context in news coverage. And I know the other ones will mention it as well, but many times, and David Allison mentioned it yesterday, is the headlines may not always reflect exactly what a current study is. So just to put this perspective and move it forward 10 years, is that what are we hearing from consumers, the US consumers? And our information surveys are conducted online. We use a research firm out of Washington, D.C., and it's 1,000 consumers, 18 to 84, that's representative of the US population. So last year we asked, basically, as you can see here, is that essentially when you read something about food and nutrition, essentially here is that what do you really see as credible sources? And so who do you believe? And if you'll see here is that this basically, it's really comes down to that individuals basically believe themselves. You know, the key is in that regard is that it's what I research, I see on the internet is more likely to be what I actually believe. So if you look at all those individual sources, we essentially say that about 60%, and this was an open-ended question, so, but really paring it down is about 60% say it's really through my own trust filter. If it's an organization of whom I believe in what they are saying, then I'm more likely to believe. If you notice here, when it's actually science, 9% basically said science-based information were more likely for them to believe. And the E there says of those, it's those that probably have college education or above. So that just basically says, again, family and friends. One said FDA, and really the fact is, you know, I really know best. This year, we asked a very similar question of last year, but we basically used closed-end questions. And you will see here, essentially here, willingness to believe food and information is basically, once again, much more influenced by one's own research. You can see that about 70% said, yes, some influence from media sources, but again, it's about what I believe in that regard. Just to find a little bit further in the past few years, then we look at food safety information, and essentially here is that we said, who do you trust when it comes to food safety? And believe it or not, because I don't know about you, but most physicians really don't talk about food safety. But in the reality is that our consumers still say, well, that's more likely the most trusted source. And we're thinking, maybe it's because they go to doctors more often or whatever, but they see that more trusted. But what's interesting, if you look at a little bit more from our perspective, is cultural, looking at different cultural aspects, and here we looked at Hispanics and African Americans, you can see that the level of trust actually does change, where it might be less from a health professional, but more to different types of media and content. So I think that's what's really important, and of course here we have such a multicultural, so what I say might affect is not necessarily in your own respective countries, but the reality is to really get to consumers, we have to understand essentially where they are. So when we say, do media headlines really equal credibility and trust? The word would probably be no in that regard, in that aspect. But I think we might say is that we see is that people are listening to it, but not always hearing or believing. So why the disconnect? I think this basically is what, it's a summary of what David Allison basically said yesterday, is that the disconnect basically comes from the multitude of agendas of which, where science then gets communicated to the public. And the reality is, as he noted, it's not always we might want to blame the media for how it's reported, but it may be how we are actually communicating that to the media. And the reality we talk about, folks like to talk to each other, and I know point fingers to say so-and-so has a bias, but I think David basically mentioned it yesterday. We all have biases. because we all come from a different, our source of information and the basis of where we grew up, so forth, and our connection with food and nutrition creates our own bias in that particular aspect. So if you really look at this multitude here, it's scientists, how we communicate it. Joe mentioned earlier is how press releases are written about science, how as scientists we may communicate that information. And then the reality is that even when publications, there is a bias within publications, obviously, to write, and many times the actual manuscript, the abstract won't always match the actual content as well. So if we are quick to criticize media sometimes, we might realize that, yes, there's definitely some issues there, but the information that is coming to the media can also be a problem. And then we mix it in with the fact is, at least in the US, there's very few science-based journalists anymore. Very good friend of mine that was for 20 years with the Washington Post, who has a PhD in nutrition but also communications, is no longer there, and they did not replace her. So we realized is that definitely that contributes to it as well. So it's going to be important for us to be able to communicate in a way that does bring about understanding. So the key here is that research has really found that journalists nearly always include dietary harms and beliefs to consuming certain foods or beverages, but can leave out essential information that may help consumers basically consider making changes in their eating habits. So very quickly here, one of the things I think is important is that every other year on our survey, we really ask consumers, would they rather hear about what to eat rather than what not to eat? And it was surprisingly, this was a major jump. This year, 72% of the US consumers said they'd rather hear positive messaging. And that is a considerable jump from 64% 2 years ago, and prior to that, it was 54%. So is it time to rethink science communication? And the question in here would be definitely yes. One of the things that is through the EUFIC Foundation is guidelines for communicating emerging science on nutrition, food safety, and health. It is on our website, foodinsight.org. Even though it's a 10-year-old document that we're in the process of updating, it really gives you some clear questions on asking the right questions and how to communicate. We also work with a multitude of nutrition experts, scientists across the US and the globe to really communicate the message in a way that will bring about some understanding. And we've moved to peer review publications as well. So how do we close the credibility gap? Very briefly, I think our call to action that I know will be communicated with the other speakers is basically all of us have to embrace the new communication tools and technology, realizing that a multitude of individuals will be communicating the message, so we need to be in all forms of social media as well, being able to bring credibility and balance to the dialogue. And consistency in messaging. Easier said than done. But I will tell you that through our focus groups, consumers basically have told us when we said, how do you know if something's true? And more than once, some of them have said, well, if I see it written the same way 5 times, it must be true. And so the reality is that's important to understand, the consistency in messaging. And finally, the key is that I realize negative sometimes sells, but the reality, consumers really want to know what are some positive messaging. Tell me what to do. Give me some guidance and be able that I will motivate individuals to change. For having been a registered dietitian and one in practice, more than once I've had clients that used to say, just tell me what to eat. And I think the reality is that giving them some guidance in that reality can bring credibility as we move forward in communicating to consumers. Because after all, our goal is for consumers to make well-informed, science-based decisions about diet and overall lifestyle. So thank you all very much. Be sure to connect with us, and I'll look forward to discussion.